Welcome everybody to today's presentation on the causes and impacts of addiction and trauma on all pieces of life. I'm your host, Dr. Dawn-Elise Snipes. We're going to define addiction and trauma for those of you who haven't watched any of my other videos on it. We'll discuss why addiction and trauma frequently co-occur, and we'll examine the causes and impact of addiction and trauma on all pieces of life. And remember, that stands for physical, interpersonal, emotional, cognitive, environmental, and spiritual. Addiction is the continued use of a substance, behavior, or person to escape from pain, and it could be emotional or physical pain, in one or more areas of your life, one or more pieces of life, despite experiencing problems in one or more areas of your life. So you're having pain in an area, and you're using to negate that pain or to numb that pain for a minute, and you're continuing to use even though use is causing you problems in other areas or maybe even that area of life. And we'll take a look at that. Spending more time, money, or energy thinking about getting, using, or recovering from use. People who spend a lot of time dwelling and just obsessing about when they're going to see somebody next, when they're going to get their next hit, when they're going to be able to get, how they're going to be able to get alcohol, whatever it is, all that planning and obsessing, then using, and then recovering from the hangover, recovering from the financial devastation of gambling, recovering from, fill in the blank. Or giving up important activities or failing to meet responsibilities in one or more areas of life. Remember, with addiction, just like any other diagnosis in the DSM-5 TR, you don't have to have every single symptom. There's a certain number of symptoms, but this kind of puts it all into a perspective so you can recognize why a person may be using and the impacts it may be having on them. Trauma, as we're going to define it here, we're not talking about big T or little t, we're just talking about T. Trauma is any event in any of the pieces of the person's life that is devastating to the person and overwhelms their ability to cope. We're going to go into depth on this, but we can have physical trauma, we can have interpersonal, emotional, cognitive, and environmental trauma. The event causes the person to feel unsafe and powerless. We've all experienced traumas from time to time. It sucks, but it's a fact of life. We all experience traumatic events. Traumatic growth occurs when a person integrates what happened and emerges feeling empowered and safe in their environment, in their skin. They've integrated it and adjusted their schema about the world in a way that is positive. Traumatic injury occurs when the person fails to eliminate the threat or the perceived threat and regain a sense of safety and empowerment. And I've used the example of tornadoes before because, we've all heard about tornadoes even if we haven't been through them. A person who experiences a tornado and then moves on to traumatic growth starts to recognize what things they can do differently in order to help themselves be as safe as possible in the future. You can't prevent it from coming, but you can have a storm shelter. You can, there's a lot of things you can do. So it's unpleasant, it's terrifying. However, you can stay safe. The person that's traumatically injured by a tornado is one who experiences the tornado and then just constantly is on pins and needles every time it starts to get overcast because they're afraid a storm's going to come through and they don't know how to feel safe. They don't know what to do to feel safe. Trauma results in a sense of a person just feeling unsafe and powerless. And think about it. In situations where you felt unsafe and powerless, it is frustrating. It is agonizing. It is terrifying sometimes. And how we adapt to that, how we get our power back is really important. But when a person feels unsafe and powerless, it triggers the fight or flight response. So we are either anxious and fleeing or angry and fighting, if you want to overly simplify it that way. That's when our autonomic nervous system kicks in, our HPA axis kicks in, and our stress response says, now's not the time to think, now's the time to do. We're running from the hungry lion. We're getting away from the danger. When this happens, we see increases in dopamine, adrenaline, thyroid, blood sugar, cortisol, which is a stress hormone, but it's also an anti-inflammatory steroid, glutamate, serotonin, and sex hormones. We see these all kind of come together to give us the energy to fight or flee, to motivate us to fight or flee, to motivate us to survive. And so it's a normal response, but when the fight or flight response stays triggered for too long, the person starts to feel hopeless and helpless. Those chemicals keep coming in and nothing seems to change. Those chemicals get ramped up because when nothing seems to change, they get more stressed out. And the body, just like someone who is developing tolerance to an addictive substance, the receptors start to become resistant to those stress hormones, and the person starts to feel flat, hopeless, and helpless. Some people begin using during the fight or flight stage to numb the pain. Some people will, when something traumatic happens, they try to have a drink, they try to gamble, they try to do something that is going to help them either feel better, divert their attention to something else, or just plain numb the pain. Addictive behavior further activates the stress response during intoxication or withdrawal, causing additional damage to the nervous system and further altering the balance of hormones and neurotransmitters, your brain chemicals. When I say intoxication or withdrawal, a lot of people think substances, when you have too much substance or not enough substance in your body. But this can be true for behavioral addictions as well, because what you're triggering and what you're becoming tolerant to is not necessarily the alcohol, the cocaine, etc. It is the neurotransmitters that are released when you ingest that. And when you ingest that substance, it triggers the release of those things. So your brain is actually becoming tolerant and resistant and to the neurochemicals that are being excreted. So the same thing happens with our stress response. We start to see damage to the nervous system when you're stressed out too long. Your dopamine and adrenaline receptors and stuff start saying, no, I can't, this is too much going through. Some people will tough it out until they feel hopeless and depressed. They'll go through trauma and they're just trying to do the right thing. They're using all those tools they've been taught. They're relying on social support, and it's just not getting the job done. And they're staying stressed and they're feeling overwhelmed. They're still feeling powerless. And that leads them to get to the point cognitively as well as physiologically where they're feeling depressed. They're feeling hopeless and helpless. Depression can be created on its own or as a response to extended activation of the stress response. And we've probably all seen people in practice who had traumatic history, CPTSD, PTSD, chronic stress. So all of that is sort of anxiety related, stress related, and then they eventually develop depression, clinical depression. They start to hit the wall of burnout. Well, burnout and depression describe that stage where the neurotransmitters just aren't able to do their job anymore. So how do we go from abuse to dependence? People experience trauma and they start using, but that doesn't make them an addict to whatever addiction we're talking about. Recreational use, and I'm going to give you a couple of examples, again, using substances, because that's what we all know. But Remember, this can apply to gambling, to porn addiction, to sex addiction, to any of our addictive behaviors, as well as to substances. But recreational use. A lot of people engage in recreational use of substances. A lot of people recreationally gamble. A lot of people recreationally have sex, and it doesn't become a problem. Okay, so that's recreational use. When we're talking about alcohol, that's less than 3 drinks per week. Now, a lot of people are scratching their head going, wow, okay. Heavy use, now we're still not talking about necessarily problematic, but we're talking about heavy use. When we're talking about alcohol, is defined as more than 4 drinks in any day and or more than 7 drinks per week on average over the past year. So when you think about that, so they're trying to incorporate what we call binge drinking as well as just persistent heavy use. But when somebody has more than 7 drinks per week on average, well, that's 1 a day. That is not a really high bar to meet. What do we consider a drink? 12 ounces of beer, or 5 ounces, which equates to about 2/3 of a cup of wine. Or, if you want to think about it a different way, 1.5 bottles of wine per week. I know a lot of people drink wine now, so I'm putting it into perspective for that. When we talk about opioids, tolerance to opioids can build up after just 2 to 3 doses and can develop possibly within hours if a patient takes high doses. There's a reason that doctors are warned not to prescribe for more than a couple of days, because tolerance can develop so quickly in the human body. Now, the interesting thing is tolerance reverses almost as quickly, which is why it's so dangerous for people when they have an opioid addiction. They go into detox, they get clean, they come out, they relapse. If they use the same amount they were using when they went in, they're probably going to OD. So that's really dangerous. The body doesn't maintain that tolerance for so long. That's also why when you've got somebody who has surgery and is on opioids for 3 days or a week, did they develop some tolerance? Probably. But as soon as they stop using, that tolerance goes away. And so they don't become physiologically dependent on it with an acute episodic use of opioids. Interestingly, tolerance occurs earlier in younger age groups. Well, it makes sense. The brain and the nervous system are still developing, so it's easier to damage the brain and nervous system. The speed and degree of tolerance development can vary depending on factors such as the specific opioid being used, long-acting, short-acting, how intense it is, whether you're talking codeine or fentanyl. Obviously, there's huge differences. The route of administration, IV administration tends to be more problematic than oral administration, but oral administration still causes tolerance. Dosage, frequency of use, individual characteristics, and whether you've got continuous exposure, like you're taking it every 4 hours, or episodic exposure. You take it in the evening before bed so the pain doesn't wake you up. So there's a lot of things we need to consider, but it's important to recognize that when the body is exposed to significant increases of neurotransmitters as a result of stress or as a result of addictive behaviors, that can actually cause trauma in the body. It actually causes the nervous system to rewire itself. When somebody is using, there's an initial strong response. You know, you have your first beer, you're like, whoa, never felt anything like that before. And then when that response wears off, there's a rebound effect. So for a lot of people, if they were depressed when they drank, and then as they sobered up, they're not going to be that same amount of depressed. they're going to be triply depressed because of the changes in the neurochemical system. So they start here, wherever here is, and this is depressed. They start to feel better, then they start to sober up, then they start to feel better, then they start to sober up, and it's this downward trajectory. So they further use to numb that distress. It doesn't feel good when you start sobering up. After exposure to excess levels of hormones or neurotransmitters, the body tries to protect itself. We've been talking about that, and recalibrates under the assumption that it's going to be overloaded. And think about hurricanes. I come from Florida. Hurricanes are near and dear to my heart. People on the coast, when they build their houses, initially, if they didn't know about hurricanes, they may have built right on the coast, right on the ground, whatever. Now we've recalibrated, we have adjusted to expect that there's going to be tide increases and flooding and all that stuff. So people now build their houses up off the beach and take precautions. And that's how we protect our houses. Our body does the same thing. It's expecting we're going to be flooding it. So it puts up this safety framework in order to be able to handle that. When people are not getting the amount of neurotransmitters and hormones flowing through their body that they need because they're not flooding the system, or they're withdrawing and, it's drying up, then they start having cravings. The body says, wait a minute, we reorganized ourselves expecting you to be flooding us, and we can't function unless you're flooding the system. This causes further dysregulation of the stress response. When the body is not getting the stuff it needs, that's perceived as a stressor. So the stress response kicks off, and people often experience anxiety, distress, cravings, etc. And that's the body saying, I need more to survive. So let's think about this. We've been talking about the process of addiction, and we've been talking about the process of tolerance. It's also important to understand the function, if people are self-medicating, of some of these substances in the trauma process, in the life process, coping with whatever is driving them to use and continue to use despite experiencing negative consequences. Alcohol increases GABA activity. Well, GABA is sort of our natural Valium, and that's wonderful. But when we detox from alcohol, that leaves the system too quickly, and the body can't rebalance. So all of a sudden, there's a compensatory flood of glutamate, which is our main stress hormone, which is why people start getting the shakes and feeling anxious when they are starting to withdraw or detox or sober up, whatever word you want to use. Initially, helps them sort of relax and let go of stress, anxiety, tension, but the back half of it, really unpleasant. Cannabis, high CBD, low THC. THC tends to be much more stimulating. So people who use cannabis often look for sedating types of cannabis that are high in CBD. This helps with anxiety. This helps with inflammation. And it helps them feel like they are kind of chilling out. It's partially impacting a bunch of hormones and neurotransmitters we've already talked about, but it's also activating that endocannabinoid system. So when we talk to people about what substances they're using, we can potentially start getting an understanding of what they might be self-medicating. Now, they could be using anything they can get their hands on, so we can't say that this is true all the time, but it can be true. Opioids, is another thing a lot of people use when they are angry or anxious, because it's a system depressant and it's going to trigger your opioid receptors as well as other calming and sedating chemicals. And cocaine, interestingly enough, some people use when they're angry or anxious, and you may think, well, cocaine's a stimulant. What the heck? Well, yes, it's a stimulant, but it significantly increases dopamine activity, which increases the release of endogenous opioids and other things that help people feel euphoric. So cocaine, even though it's a stimulant, is often used by people who are angry or anxious because it puts them into their happy place. Substances that can be used or are often used by people with depression. Now, with depression, they're already feeling low. They're already feeling flat. They're already feeling unmotivated. Alcohol and anti-anxiety medication are sometimes used when people are depressed, partly because they want to just numb it. They don't want to feel the pain anymore. And if their depression is caused by dysregulation of the autonomic nervous system because they've been too stressed for too long, too traumatized for too long, then turning down that stress response so they're not, running an engine that's already run dry can be really helpful. It tries to help increase GABA to help them feel relaxed. They still may feel helpless and hopeless, but they may feel relaxed. Cannabis. A lot of people with depression tend to gravitate towards cannabis with higher proportions of THC to CBD. They found that low doses of THC increase serotonin levels, while high doses can decrease serotonin levels in people. And remember again that depression and depressive symptoms are caused by a whole lot of things, not just serotonin levels. But some people find that the not super powerful, super intense cannabis that has the higher THC ratio may be more effective, or may be effective for them to self-medicate. Unfortunately, chronic THC use may lead to decreased serotonin activity over time for the same reason. Those endocannabinoid receptors start becoming resistant and tolerant to stimulation by the THC. As I said, THC may help regulate the mood through interactions with the endocannabinoid system. Endocannabinoid system, there are natural cannabis receptors. Activating those also activates endorphins. It activates anti-inflammatory chemicals in your body. It alters your neurotransmitters in some ways. So we're starting to see how some people may self-medicate with substances. And yes, they can also self-medicate with behaviors that produce pleasure, like sex, or produce distraction, like gambling. It lets them focus on something else. It promotes the release of dopamine. And when they win, because they will occasionally win, there's a rush, there's a euphoria. And so through the substances, they may be trying to artificially rebalance the neurotransmitter cocktail in their body, if you will. Opioids alter emotional responses to stress and fear-inducing stimuli, which is another reason some people, when they take opioids, they may feel more relaxed, but they also may feel more energetic if we're turning down that stress response so they don't feel just completely oppressed by their own anxiety. Then they may appear to have more energy. Opioids decrease activation of GABA neurons, which increase dopamine. So GABA is our internal natural volume, so to speak. And when that is decreased, dopamine, our motivation chemical, goes up. So we see, and I've had a lot of clients who have been in recovery from opioid addiction, and they report when they're using, they feel like they're sort of invincible. They have so much more energy and they're so much more motivated. Well, this is one of the reasons. The opioids can inhibit the transmission of signals between neurons. So some of these stress messages may not get out, which can be helpful. Cocaine increases excitatory, stress-related neurochemicals and hormones, but because it's an excitatory substance, it gives people energy when they haven't had energy before. We need to be really cautious when we're working with somebody who has major depressive disorder, because when they have energy for whatever reason, whether they started taking a antidepressant and they're getting some more energy, or they're using a stimulant that is giving them more energy, they're at a very dangerous place, because they may still feel depressed, but now they have energy to act on any impulses that they may be thinking about acting on. Questions we want to think about when we're doing our assessment of clients. Is the depression related to acute anxiety? Now, if it's acute anxiety, then the body hasn't developed all this tolerance and everything, and the person had a stressful situation, a traumatic situation, and it left them feeling hopeless and helpless. So a lot of that is cognitive, and could be somewhat environmental too, if their house burned down or something. If the depression is related to intolerance or excitatory chemicals from chronic stress, tolerance to those excitatory chemicals from chronic stress, then their treatment plan is going to be a little bit different, because now we have to start healing that autonomic nervous system and that HPA axis in order to help the body naturally rebalance itself. Yes, we still have to deal with the cognitions of hopelessness and helplessness and all that stuff, but we also have to make sure we're attending to the physiological consequences of chronic stress and trauma. Thinking about some of these other addictions and what they have in common: sex, porn, gambling, gaming, and adrenaline. All of them increase serotonin and dopamine and excitatory neurochemicals. So all of these can give people a sense of euphoria. All of these particular behavioral addictions have a tension and release mechanism. There's a buildup to it, and then there's that release, whether it's orgasm or winning a big pot in gambling or whatever you win in gaming. I'm not big into internet gaming, but there's a euphoric moment. Thinking about how these reduce physical, emotional, and cognitive trauma memories and mood issues is important for a clinician to really conceptualize. It helps us turn our attention away from the traumatic event. It helps us focus our attention on something pleasurable and ignore that traumatic event. It helps release positive feeling hormones and neurochemicals, which can help us temporarily feel better emotionally. Other addictions we might consider are food or eating addictions, in which people gravitate toward highly refined foods, like really processed foods, or foods that we call memory foods. And those are foods that trigger positive memories, trigger a feeling in their body and in their mind of when they were safe, when they were empowered. And it's often something they had from childhood. And relationships are another type of addiction. We can get addicted to people. Even if it's a destructive relationship, it may feel better than being alone. Like other addictions, these food and relationships increase serotonin and dopamine, but somewhat unique to these two things is we also see a significant increase in oxytocin, which is a bonding hormone in a lot of people. And both of these behaviors, the food often reminds people of a time when they felt loved, when they felt secure, and the relationships are a way designed to help people feel safe and secure. So both things are geared towards helping somebody feel safe, maybe not empowered, but it reminds them of a time when they may have felt safe. And in that way, it can help reduce cognitive trauma memories and mood issues. And again, it's only for a short period of time, which is why it becomes problematic. When we talk about physical trauma, and I told you we'd talk about all the different kinds of traumas, injury or sudden illness is traumatic. If you were in a car accident and you developed a traumatic brain injury, it's right in the title. After a sports injury, if you tore your ACL, if you're a professional athlete and you tore your ACL, your career's over. Even if you're a recreational athlete and you tear your ACL, there's a long period of recuperation after your surgery, and it's going to have significant impacts on your daily life, your activities of daily living. For somebody who is an avid recreational sports enthusiast, this could be extremely shocking for them to not be able to do the stuff that they want to do, and can trigger a lot of anger. Heart attack, stroke. Well, obviously, when you have one of those, it's traumatic, not only to you, but to those around you. And recognizing that the recovery process is going to be longer. Birthing trauma. Again, it can be traumatic for the birth parent as well as the family, because I remember when my son was born at 29 weeks. I mean, he was so little. Actually, he was really long, but he was really skinny. But it was traumatic for me to not be able to hold him, to not be able to touch him, to, have all these doctors telling me, well, we don't know which way this is going to go. That was traumatic. For my family, it was also traumatic because there was nothing they could do to help him, to heal him, to anything. We just had to kind of stand by and trust. So that was traumatic. And I think most of us emerged stronger through it, but it did impact us all physically. We had stress-related symptoms. We had difficulty sleeping. We had sometimes appetite changes. We had increased systemic inflammation because we weren't sleeping as well. And I say we because I know neither my husband nor I slept really well while he was in the NICU. Interpersonally, it impacts your relationships after you have this sort of thing. If you had a sports injury, maybe you used to always go out and play golf with your friends, and now you hurt your back and you can't play golf anymore. My stepfather went through this. He played 9 holes every single day, come rain, well, not come rain or shine, but you know what I mean. And this is when he got his socialization in, and this is when he connected with people and got grounded for the day mentally. And he hurt his back when he was, I think it was when he was in his early 70s. And he was never able to go back to playing with the same frequency or intensity that he could. And there was about 18 months there where he couldn't play at all. And he went into this huge depression because he felt like it was his body giving up on him. So there's a lot of emotional and cognitive trauma that goes on when we have an injury, when we realize our own mortality, when we're blocked from doing things that are important in our rich and meaningful life. Diagnosis of a chronic illness like diabetes, fibromyalgia, Crohn's disease, cystic fibrosis, cerebral palsy, all of those things can be traumatic to the individual as well as potentially traumatic to the family. The family going, oh my gosh, I can't fix this one. I can't make this one completely go away. And we need to help people to develop skills and tools to say, all right, I can't make it go away, but what can I do to help this person have the highest quality of life? What can I do to be of support for the individual? I can't make fibro go away, but how can I, as Hayes would say in acceptance and commitment therapy, how can I live in the and? How can I have fibromyalgia and do things that are important in my rich and meaningful life? Birth defects, including fetal alcohol spectrum disorders, can cause a lot of trauma for the individual as well as the family. The birth parent may feel very guilty for not being able to, believing that something they did may have caused this birth defect or trauma. And in the case of FASD, yes, drinking, fetal alcohol spectrum disorder, drinking during pregnancy can cause FASD. And if the child has it, then we know what caused it. It may not have been intentional. The mom may not have known ahead of time that she was pregnant and she was still drinking. We know that happens. So we need to be sure that we're not villainizing or stigmatizing people who experience a trauma. And we also need to help them wrap their head around the causes, the objective causes of birth defects. But there also is often, whether it's birthing trauma and prematurity or birth defects or FASD, the family may, in their feeling of powerlessness, try to regain some power by blaming the birth parent. And it's really important that we help the birth parent as well as the family navigate their feelings about what happened and identify the objective realities of the situation. Terminal illness. Diagnosis of a terminal illness is traumatic for the individual and the family. And I don't think I need to explain why that is. And there's a lot of anticipatory grief that goes along with terminal illness, because when you know something's terminal, then you feel powerless and you may feel unsafe. The person with the disease may not know when it's going to really, accelerate, or they're going to decline a lot. So that's scary. They never know on a day-to-day basis, is today going to be the day? With Alzheimer's, they're anticipating what could happen, and it feels very unsafe because they know where they're going. And that's extremely traumatic. For the family, seeing a loved one, not being able to fix it, like we talked about with other things, but also recognizing, hey, my loved one had this, which means I could get it. So a lot of people may have this trauma, this sense of feeling unsafe in their own body because they've got the same genes as somebody who has this terminal illness. And addiction. Addiction actually causes trauma. Addictive behaviors, whether it's substances or something else, cause trauma to the nervous system. When you're overdosing or overloading the system during intoxication, and when you're depriving the system during withdrawal, both of those trigger the stress response. Addictive behaviors can cause trauma through accidents, DUIs, etc., and physical fights. Increased inflammation and chronic pain. This is physical trauma, but it's still trauma because, if you're waking up every morning and you're in chronic pain, it's going to affect you physically, interpersonally, emotionally, cognitively, spiritually. That's just the way it happens. When we're in chronic pain, it impacts every area of our life. And that increased inflammation may be caused by the dysregulation of the nervous system caused by the addictive behaviors. Opioid-induced hyperalgesia. Obviously, this is only for people who are abusing opioids, but people who abuse opioids, when they are not getting the opioids, their nerves actually may be more sensitive. They may actually feel more pain, partly because their body's not producing the endogenous opioids anymore because it said, hey, you're going to ingest them all, so why should I do the job? But there is a period during that detox where people feel intense, increased pain. They feel fatigued. They have anxiety, all the opposite feelings of what they had when they were using. And I remember working on the mother-baby unit. After the mother would give birth, then our attending would discontinue her methadone like right then. And so not only was she going through hormone changes, but she was also experiencing more pain, more irritability as a result of not having those, what we call exogenous opioids, stuff that you get from outside. Chronic illness, cancers, ulcers, COPD, and neuropathy can all be caused by addictive behaviors, especially substances. Worsening of chronic illnesses is often related to stress, and use and withdrawal from addictive behaviors increases stress in the body. People with autoimmune disorders are going to have a worsening of that chronic illness. People with cancer, their immune system's going to have a harder time doing its job when the nervous system is dysregulated. So addiction can cause physical trauma. It can cause the body's illnesses to get worse. Dysregulate. Some people, when they have addictions, this isn't a physical trauma, it's a interpersonal trauma, but their loved ones may finally set boundaries and say, we're not going to enable you anymore. And they interpret that as abandonment. So now they've got abandonment trauma on top of whatever else started this path. Dysregulation and difficulty coping with life once tolerance develops. We know that once that nervous system, that autonomic nervous system becomes dysregulated, then when people are stressed, they go from feeling flat to furious or flat to frantic. And that is a neurochemical change in people who are exposed to chronic stress and trauma. Guilt and shame develop when people have an addiction. No surprise. And housing and financial instability can develop. And that's traumatic. If you don't know where you're going to lay your head or how you're going to get your next meal, that's traumatic. I'm sorry, I don't care who you are, but I think I would feel unsafe and powerless if I didn't know those things. Interpersonal causes of trauma. A lack of secure initial attachment or abandonment issues can cause people to feel perpetually unsafe in relationships and unlovable. And that's traumatic. And a lot of people will turn to addictive behaviors to numb that pain. Rejection and abandonment, including abandonment through death by people you trusted, family, friends, or even a pastor or religious leader, can cause people to feel unsafe and powerless. With the pastor, they may be saying, hey, not even God was here for me for this. So, who can I trust? Where can I be safe? Being bullied in real life or online, including doxing and cancellation, are also traumatic to people. They don't know when they're going to be safe, and they're kind of waiting for, most people are waiting to be either doxed or canceled. It's not a if, it's a when in their minds, and that leaves them feeling unsafe. When you're canceled, it can have significant repercussions on your life. And that doesn't apply just to influencers. That applies to, a clinician who has a website and an Instagram channel or something. All of a sudden, her clients may just dry up overnight. And abuse in any of the pieces of life, physical abuse, interpersonal, emotional, cognitive, environmental, and spiritual abuse, can cause people to have difficulty trusting others and have difficulty feeling safe in their own skin. Emotional and cognitive causes of unresolved trauma and pieces, and the impact on all pieces include emotions and beliefs are reactions to trauma. We need to recognize that. If we have a negative perception of things, we need to recognize where that comes from. And our emotions, our feelings of unsafeness are going to change our beliefs and our perceptions, which often, unfortunately, compound our feelings of unsafeness. So we need to kind of break up this self-fulfilling cycle. Unresolved grief, including the emotions of anger and depression. When we experience a trauma, the traumatic incident often involves a loss. It could be a loss of functioning, it could be a loss of a friend, or it could even be a loss of your belief in society or human beings as good people. You know, the way you conceptualize the world may all of a sudden be shattered. Unresolved anxiety, if the person is continuing to feel unsafe in relationships, in their own skin, continue to feel like they're unable to meet their needs for safety, security, love, and acceptance, are all going to contribute to ongoing trauma. Distorted beliefs causing the person to interpret the world through a trauma lens and continue to believe that they're powerless. And these are things that we need to address in treatment and help people really evaluate the facts in this context at this time. For and against your belief. What are the facts in this context at this time? And you know that I use the mnemonic for that, FitCat. Environmental causes of trauma. See, people don't have to just have some violent event to have trauma. And that's what I'm trying to drive home here. People can have environmental trauma, natural disasters, fires, accidents, loss of their home, and it may not have disappeared. They may have gotten evicted, loss of financial stability, loss of family, especially if your family either rejects you or the person is yanked out and put in foster care. Frequent, especially sudden moves, house moves, and other environmental triggers. Environmental causes of trauma can be triggers in the environment, things that remind you of a trauma in the past, such as somebody in Walmart with the same cologne as your abusive uncle used to wear. So in the environment that you're in now, uncle's not there, but you're being reminded of it, and it feels like you're back there again. So that can contribute to people feeling unsafe because they don't know when those memories are going to be triggered. Spiritual causes of trauma, being told you belong only if you do what you're told. Being told you are never good enough, you'll never measure up to deserve to be loved. Being told that there's a loving God but never experiencing love or safety. And believing that there's no rhyme or reason to what happens. If there's a plan, why did this happen? Or if there's a God, where was he when this happened? Those are questions that indicate spiritual trauma in people where they don't feel a sense of connectedness to a higher power. Closer look at the pieces impact. All of these traumas leave the person feeling powerless for some period of time. This activates the stress response. Normal. That's crisis. Ideally, we're getting a bunch of energy and motivation dumped into our system so we can figure out what to do to regain safety and feel empowered to take those steps. So if the crisis is resolved, the person once again feels safe and empowered. They use the energy to grieve the loss. They use energy to figure out how to accept or integrate this new reality, and they adjust their expectations for the future. Physically, if this trauma is unresolved, and remember, that could mean ongoing addiction. If somebody's continuing to traumatize their body, the stress response is going to get dysregulated, as well as the entire autonomic nervous system. They're going to have difficulty regulating their stress response. We'll see symptoms of hypervigilance, sleep and circadian rhythm difficulties. And interestingly, people who've experienced or who have unresolved trauma as well as people who are abusing substances. And when they're sleeping, they're generally in a withdrawal sort of place. It leads to increased muscle tension, which reduces airway stability during sleep, causing a significant, up to 70% increased probability of sleep apnea in individuals who have experienced trauma or who are abusing substances. Nutritional deficiencies and gut dysregulation. When we get stressed, our gut microbiome changes and our body says now's not the time to rest and digest. We got to fight or flee. So it's not breaking down and absorbing the nutrients that it needs. When we don't have the nutrients, we can't make the neurotransmitters. We can't make the neurotransmitters, then we're going to have a problem. Blood sugar regulation issues. A problem for anybody, but a big problem for people who already had diabetes or pre-diabetes. Altered immune system. When we get stressed, our cortisol, that stress hormone that's also a steroid, loses its ability to suppress inflammation. So now we see increased inflammation in the body. We see increased pain, increased problems with autoimmunity, and reduced immunity. We become more susceptible to illnesses. We also see an alteration of gonadal hormones as a result of chronic stress and trauma, and potentially hypertension and cardiovascular diseases. Interpersonally, we see a sense of low self-esteem and self-efficacy. Now, all of these are potential treatment plan targets. If somebody has a sense of low self-esteem and self-efficacy, we need to figure out how to help them address that and at what point in the treatment process. They may feel isolated, like nobody understands. They may have abandonment fears if they were abandoned, or maybe they experienced a trauma and it's like all the people that they used to play golf with don't even call them anymore because they can't play golf anymore. So that feels abandoning to them, which, I get it. Or they used to be a football player professionally, and now they can't play football anymore, and they're not in the limelight, and they don't have all those same people around them anymore. So there can be a lot of abandonment that occurs after a trauma. There can be a lot of abandonment that occurs when somebody is addicted to something, because they may cause damage to their relationships through their addiction, and people start setting boundaries and saying, I just can't, this hurts me too much. There may be a need for approval, sometimes appearing narcissistic. There's often irritability and argumentativeness because they're in that fight or flight stage. They're feeling unsafe, or they're intoxicated or withdrawing, if we want to simplify it. So that stress response is activated. They're going to tend to be more irritable. Codependency, hypervigilance, distrust of others, unstable relationships, becoming a chameleon. If somebody has experienced trauma, or if they have an addiction and they've experienced abandonment, for example, or they're fearing abandonment, they may start trying to be whatever anybody else wants them to be so they don't lose the support that they need. They don't lose the love. They don't really believe it. They are just putting on a facade. And then in the cases of families where there are children and a caregiver has a trauma or an addiction, we often see the children exposed to adverse childhood experiences, including neglect, because the parent, while they may want to be there, they are so overwhelmed with their own stuff that they can't get out of their own way to be emotionally and or physically present for the child. We also see more domestic violence, etc. Emotionally, we see dysregulation, people flat to frantic or furious. Anxiety, anger and resentment. Remember, fight or flee, anger or anxiety. So if you're triggering that stress response, you're going to have those emotions coming through sometimes. We may see guilt in people who want to change, but don't know how, who want to feel better, but don't know how, who see the destruction they're causing, but don't know how to change. We may see jealousy in somebody who's experienced trauma or who's addicted and fears abandonment, etc., when they see other people having the things that they want in their rich and meaningful life, but they don't know how to get them. Apathy, depression, and low motivation. Well, as our dopamine goes down, which happens in addiction, dopamine is responsible in large part for those three feelings. Cognitively, attention deficit, difficulty learning new things, problem-solving deficits, disorganization, difficulty planning, and poor memory. All of these we kind of lump together and call executive functioning. And stress, when you're in fight or flee, you're not using your executive functioning. So somebody could appear to have ADHD when they may be struggling with trauma, when they may be struggling with the neurochemical effects of repeated intoxication and withdrawal from their addictive behavior. We also see brain fog, people waking up and they feel kind of like they're hungover all day long. And negative and self-perpetuating thinking styles. When we tend to be in a negative state, we tend to perceive things through that negative lens, and we see the threats. We don't tend to not pay attention to the things that we're grateful for, to the things that we're empowered to do. Environmentally, as I mentioned, when people are having physical issues, interpersonal issues, emotional issues, it's going to be hard to keep a job. So they may have job instability, housing instability, financial instability, a sense of increased lack of safety as a result of those generalized triggers we talked about. They see, alcohol when they're at Walmart and it starts their craving to want to use. That feels unsafe. They smell that cologne. That makes them feel unsafe. So whatever is traumatizing or caused their trauma can be triggered in other situations. And then we also may see a lot of disarray. Their lawn not mowed, weeks of dishes not done, clutter kind of everywhere, because that's not what they're focused on. They're exhausted. They're having difficulty just kind of getting through the day. Spiritually, they may be experiencing a sense of disconnection and not belonging anywhere, helping them figure out, where they might feel like they belong. They may have a loss of faith in self, others, the universe, the power greater than themselves, their higher power, all of the above, some of the above. Helping them identify what does faith in self look like and how can you regain your faith in yourself? What does faith in your best friend look like? How can you start regaining faith and trust in that person? And they may have a loss of hope for change and happiness because they've been stuck in this cycle for so long that they don't feel like there's any hope. There are many different types of trauma, all types of trauma, physical, interpersonal, emotional, cognitive, environmental, and spiritual trauma. All types of trauma can impact all pieces of your life. We need to recognize and treat the person holistically. Healing starts with helping the person be and feel safe and empowered in the present moment. Healing the stress response takes time and requires addressing all of the impacts of trauma in the person's life. Not all at once, it's probably going to take a minute, but starting out with helping them figure out how can they reduce their stress, the stress on their body. And in early addiction recovery, the first 30 days out of detox, people need more sleep. People need to set their circadian rhythms. People need healthy nutrition. That way, in the next 30 days, they can start thinking more clearly. But during that first 30 days, it's really sort of an extended detoxification period while their body heals to get to a place that they can engage some of those other behaviors they need to for recovery.